It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
Hi again, everyone. Jim Knox along with Candace Kruger, and welcome back to another edition of the Best Docs Network, featuring some of the best doctors in the entire Dallas-Fort Worth area that help change people's lives.
Like our first doctor, it's OB-GYN, Dr. Patrick Allen.
Nexplanon is a long-term 3-year implantable rod used for contraception. It is a small 4-meter rod that's inserted into the inner side of the arm, and it releases a low dose of progestin only, hormone, over a period of 3 years.
I had previously been on the pills and I decided not to do that anymore. I literally had to do it every morning, the same exact time, or at night, the same exact time every single day, or it was supposed to be not as effective. Same for the NuvaRing, you had to have it in 3 weeks and take it out for a week and then put it back in. So if you miss putting it back in, once again, you have that worry. So they said the implant in your arm was really the best fit for me.
It's commonly used for women who want long-term, worry-free contraception, and it is very preferable for high school students, college students, or busy moms who are spacing their children and who do not remember to take birth control pills.
Mari, she was very sweet, and she told me exactly what she was going to be doing as she walked me through the whole process and just talked to me like she was a friend.
We just inject some local anesthetic into the arm under the skin prior to inserting the Nexplanon. The Nexplanon comes in an inserter device ready for insertion. There isn't any incision. You insert the little rod under the skin and put a Band-Aid on it. It's done under sterile technique. It takes about 3 minutes.
This, I actually have no menstrual cycle at all. I have not had one in 3.5 years. So that's another great thing about it, is I don't have to worry about that at all. Wake up in the morning, don't have to think about it. Go to sleep at night, don't have to worry about it. I go throughout my day, and that is the last thing on my mind, is getting pregnant.
Roger had a traumatic spine injury that kept him from walking until he met Dr. Rebecca Stachniak. To find out more about Roger's story and other life-changing stories, log on to bestdocsnetwork.com.
The way I met Dr. James, he's actually coaches my daughter's soccer team. He had overheard a conversation I was having with another mother saying that one of my MRIs had come back and that my thyroid didn't look quite right, but I really wasn't putting a whole lot into it because I didn't really have any of the symptoms.
Patients with thyroid problems can range in 2 different areas. One is if they have hyper or hypothyroidism and they feel tired, run down. They'll have a change in appetite, sometimes hair loss, and in some cases patients will have a thyroid nodule, an enlarged thyroid, and that's typically when they get sent to myself or an ear, nose, and throat surgeon to evaluate.
After I had all of the tests done, my husband and myself went into his office and met with Dr. James to discuss how we were going to move forward after they had found some atypical cells in my thyroid.
In the case of Ruth, she presented from her primary care as a referral for an evaluation of a thyroid nodule. She underwent a needle biopsy of the thyroid nodule, which showed evidence of possible cancerous cells. We took her to the operating room and performed a biopsy of that portion of her thyroid gland, and during surgery, pathologist reported that in fact it was a thyroid cancer. We took the rest of her thyroid out in that same setting and removed all thyroid tissue completely.
I really expected to be in more pain. The first 2 days were pretty rough, but after that, it wasn't nearly as bad as what I thought it was going to be.
She then stayed in the hospital for one night and went home the following day, and after approximately a week was back to a normal activity and doing well.
If it wasn't for Dr. James, I think I would have blown it off if he would not have said, hey, this is kind of serious and it's more important than, fixing your neck, and you need to, you really need to put more attention towards this. It's so important, to go and have those tests done, to take that extra step, make the time. With 4 kids, I have an extremely busy schedule, and I just had to put everything aside and say, okay, right now, I'm more important.
If you've had a doctor help change your life, we'd love to hear about it. Send us an email at info@bestdocsnetwork.com.
We're all different. We like different things. But one thing nobody likes is pain, especially when it keeps us from doing the things we love. Luckily, Pam is here. Whether it's back pain, carpal tunnel, foot and ankle pain, or more, PAMA physicians are dedicated to their specialties and dedicated to your quality of life. Don't let pain keep you from doing the things you love. PAMA, pain freedom.
The Best Docs Network features some of the best physicians in the Dallas-Fort Worth area that are helping to change people's lives. Like our next doctor, it's Dr. A.L. Shaw, pain management specialist.
Woke up one day about 13 years ago and couldn't stand up straight. And after seeking medical attention, sort of a variety of ways, one of the doctors I saw suggested I come see Dr. Shaw.
When we examine scars, I simply take something such as a PDA stylus that is very blunt, allow them or stimulate a non-scarred area remote from the area with the scar, so they know how this particular stylus feels with the amount of pressure I'm generating. When I touch the scars, quite commonly they are numb. They don't feel them at all until I hit an area of nerve entrapment. And those areas we mark with a skin marking pencil, and those are the areas that we inject deeper than the skin, and then we also inject the entire length of the scar.
As you move away from your surgeries in time, you find that there's sort of a new sort of pain. After you heal from the surgical pain and you get back into your daily life, you find that there's some new kinds of quirky little aches and pains and bristly things going on, and it can be scary. At first you can think, oh, my problem has returned.
Relative to her scar pain, really did achieve pain freedom. She has other problems that are still generating pain from her spine, but even that's much improved, not from the other therapies that we've done, but just from the scar injections.
It's comforting to have Dr. Shaw on my side, to know that it's his goal as well as mine to bring me pain freedom, and we work at that together, and I think we're doing a good job.
Your thyroid gland is an important organ. It's right here, right in front of your windpipe. Now, many people can be low on thyroid. That's hypothyroidism. That's the most common type of thyroid disorder. And there's also hyperthyroidism, an overactive thyroid. That's less common. The hypothyroidism is more common in women, but it does affect men, and it can cause symptoms such as weight gain, fatigue, thick skin, coarse hair, constipation, all kinds of things, all of them involved in slowing down of your bodily functions. Now, if that's the case, you go to your doctor's office, they draw what's called a TSH, thyroid stimulating hormone. That will be low, and then the physician can start you on a medication that will improve your thyroid hormone level in your body. Your metabolism will come back to normal, your weight may go down, your skin and hair changes will get better, and your energy level will respond. Now, if you're hyperthyroid, overactive, that can be a problem with heart problems. It can cause atrial fibrillation, which is a rhythm disturbance. It can cause excessive anxiety, as well as high pulse rate and trembling. So if you have any of those symptoms, get your TSH checked by your physician.
It sounds like such a simple problem, but in reality, it's actually a very frustrating condition to have. Millions of people have it, and they're not sure how to treat it.
Toenail fungus, or onychomycosis, is an infection of the toenails by a fungus that usually lives underneath the toenail and eventually causes it to become discolored. Sometimes it thickens, and you'll notice a debris underneath the nail as well.
My symptoms were that I was dealing with was the yellowing of the toenail. It did make me very self-conscious of wearing open-toed, trying to wear sandals. It just didn't make me feel pretty at all.
Treatment options for onychomycosis vary from topical medications such as medicated toenail polishes. There are oral medications, and there's nail laser treatment as well.
There's different nail lasers on the market. This has actually gone to our second laser. I like this laser a little bit better because it's a series of 3 treatments, which I think is a little bit better because it penetrates that nail on several different treatments. So it's treated on the first treatment, and then 2 weeks later you do your second treatment, 6 weeks later you do your third treatment. Again, by that third treatment, usually you can see a good clearing of the nail bed.
The process was I came in and they hooked me up on a machine, and I was out within 5 minutes. Painless, wasn't no needles, no anything. It was just, they just hooked you up to a machine, just put a little tape on your toes and you were done.
The nail laser treatment works by using a laser that kills the fungal cells but leaves all the natural cells to the toe and toenail unharmed. It's usually performed in a series of 3 treatments to kill the fungal cells at the varying stages of their replication.
I feel prettier, and now I love wearing open-toed shoes, and I just feel better about me all over, just with my toes looking better.
Jacob's quality of life was affected due to gastric reflux disease until he met Dr. Glenn Eide. To find out more about Jacob's story and other life-changing stories, log on to beststocksnetwork.com.
About 10 years ago, I was having a lot of shoulder pain, and I had seen several doctors prior to that. And they told me that I had a problem at C6, C7. And I was looking at surgery and a possible spinal fusion. So I called my friend who works in critical care, and I said, who's the best neurosurgeon out there? And she gave me Jeffrey Caterini's name. So I went to him. He said, your symptoms don't fit your MRI. Your MRI is wrong. And I had seen 4 previous physicians prior to that, and Dr. Caterini is the one that caught it. I get emotional.
One of the procedures we offer here in the practice is insertion of a cervical artificial disc. We see patients aged 20 to 55 who have a soft tissue disc herniation or 1-level disc disease. And they typically present with one-sided neck pain and arm pain.
He came and sat right down next to me, and he showed me the artificial disc and the way it worked and the way he would screw it in. And I said, you know what, that's a metal disc, ball and joint. That makes sense to me. You know, I didn't like the idea of pulling bone out of my joint or out of my hip and then fusing my neck, and I have limited range of motion. That just didn't make sense.
The good thing about the artificial disc is not restricting movement, it's keeping movement. And there's no need for a cervical collar post-op, or there's no need for a bone growth stimulator post-op because you do not want to promote a fusion.
And I woke up from surgery, the pain that I had had for over a year was gone. And I just bawled. So right after the surgery, I was out there playing tennis immediately with absolutely no pain. Best decision of my life.
Nancy did great post-op. She returned to her activities. She's actually referred friends from out of state with artificial disc, and she's very happy with the results, and she's got great range of motion.
Go to a neurosurgeon. They're meticulous, and especially go to Dr. Jeffrey Catarini because he's outstanding.
As always, for more information on any of the fine doctors you've seen on today's show, just log on to our website, bestdocsnetwork.com.
BestDocsNetwork.com, the #1 medical video source as far as educating the public. Right now, Ken, it's time to head for our next best doctor. It's oral surgeon Dr. John Wallace.
I lost my teeth and had dentures at an early age in my early 30s, and I suffered from periodontal disease. They were ill-fitting, and I started suffering from burning mouth syndrome.
Susan is a remarkable case because she did lose her teeth beginning at a very early age. She put her dentures in with a lot of glue, went to work, it started to hurt so much, but of course she can't go without her teeth, she has to wear them. So she endures this pain through her workday. Comes home, takes pain medicine, takes her teeth out, and goes to a dark room and goes to sleep.
We talked about the procedure, about removing some of the bone on the top and bottom on the gums so that I could get a proper fit.
We took out the remaining teeth, we placed implants in a bone, and we attached teeth to the implants.
It entails just 4 screws implanted on the top and the bottom. Then the teeth are made with the holes, and they're attached.
We can place the implants, attach the teeth to it the same day, and now they go home and they're using teeth all in one day. That's what's remarkable. That is why implants have changed dentistry.
I would recommend the All-on-4 to anyone that is having any kind of gum disease, loss of teeth, that have ill-fitting dentures.
Her smile is even bigger than it ever was. She went home, she didn't have to take things in and out, she didn't have to use glue anymore, she got off all the pain medicine. She was a completely different person.
I enjoy going out more. I'm not worried about what people, think and being uncomfortable with the dentures. I feel more confident. My husband and I go and do things that before didn't want to do because I was more comfortable at home with my dentures out.
We got to change her teeth to be exactly like what she wanted. It's a great treatment for patients who want to go home with teeth or who can't tolerate dentures. It's an amazing thing that we can do with dental implants nowadays.
Many of us live with pain, but you don't have to. PAMA's here to help. Whether it's sports injuries, arthritis, or joint pain, the physicians of PAMA are dedicated to your wellness and getting you back to pain-free days. So what are you waiting for? Go to PAMAinc.net and find a physician or orthopedic specialist who can help you stop pain and live life to its fullest again. PAMA, pain freedom. Go to PAMAinc.net.
I had gone through 2 major back surgeries. I have a lot of bolts and screws and nuts and squirrel cages and fusions in my back. I have had a terrible time with all of the pain I experience in my everyday living. I lived on pain pills and my quality of life was awful. I wasn't the guy I wanted to be for my family, for myself, so I needed another way of life.
Greg is a prototypical guy. He hurt his back doing some heavy lifting. He ended up having a spine surgery, and he ended up having a second surgery. And when he came to me, he was very disappointed with the results of his surgery. He was almost at the end of his proverbial rope, feeling that there was nothing for him.
He said I was pretty screwed up. He said my back was quite a mess. He went back to the original x-rays and took me through this, and I went through a lot of spinal injections. He had recommended we did those, and they gave me some temporary relief, as he said they would. The pain would come back, and so we got into the next phases of doing the spinal cord stimulator.
That is an electrical device that is implanted in the spinal canal next to the nerve roots that are causing their pain. It produces a sensation of pressure or tingling in the areas that they typically have pain. The brain actually pays attention to that pressure, that tingling sensation, more than it does the pain. So they actually don't feel as much pain, or sometimes no pain at all, from those typical areas.
I take and I turn it up, I put it on, and I turn up the volume, and I sit for 5 minutes or 10 minutes. That's better than taking the pain pill because I can manage my pain much better. I really do have pain freedom when it comes to working with the operations. And I'm very, very pleased with where I'm headed.
For more information on any of the great doctors you see on today's show, head to the website. It's bestdocsnetwork.com. Bestdocsnetwork.com, the #1 medical video source as far as educating the public. Right now, time to head to our next best doctor. It is Dr. Carol Norton.
The DietMD program is a medically guided weight loss program for long-term sustainable weight loss.
I've had bypass surgery twice and 5 heart attacks and had gained a lot of weight since being about 40. Doctors had wanted me to get it off, my wife wanted me to get it off, my family wanted me to get it off. My blood pressure was elevated, high cholesterol. So I just determined that I had to do something, and this sounded like it would fit my personality, and I was ready to do it.
It starts with a medical, physical, lab work, EKG, making sure that the patient is in fact safe for an aggressive weight loss program.
There's a body bug that I wear all the time. This measures calories and steps. Then you log the calories into the body bug system, and every week you meet with your nurse and we review what I've done. How many calories did I burn? How am I burning them? What did I consume, what my fat percentage is.
Mr. McAtura is a client who entered the program in September of last year, so he's been on the program for about 8 months now. Has lost about 95 pounds, so he is a very good success story for this program.
The support that you get here, the interaction, is another key to the deal. You know you're going to have to check in with somebody. And that's always a motivator, for me anyway, and I think it is for most people. It's been a big help.
Patients notice drops in their blood pressure, diabetic medication, things like that. Many times we can certainly expect a decrease in these medications, if not an elimination altogether.
For my wife in particular, it eases her burden. If she hears my cardiologist say, "Dave, this is great. These numbers are super, where your heart is stable, your cholesterol is from, it was at 79, now it's at 32. We're going to cut back on your cholesterol medication." Those kind of things just make it easier for the entire family and for me to plan for the future. With this diet, I felt good from day one.
If you've had a doctor help change your life, we'd love to hear about it. Send us an email at info@bestdocsnetwork.com.
I was a veteran in the United States Marine Corps for 4 years, did 2 tours overseas. And I went to the VA because I had been having recurring panic attacks and tried to take a route through private insurance and doctors and everything. And nobody really saw me as somebody who might potentially have issues. Like, I think I might need something like this since I've tried all these medications and it haven't worked. They were like, "Oh, this kid's just a pill popper." Long story short, it was just like a bad confluence of events. And between a bunch of stuff happening, I was like, I need to talk to somebody about what's going on, so that's why I came here. Specifically, I came to Germany because I wanted somebody who was a veteran and had that background and could identify with me on that level.
I see a wide range of clients, but primarily I focus on veterans.
active duty, military personnel, their families, friends and loved ones, basically veterans and anybody that comes into contact with them that could use a better understanding of what they're going through. And also I see a lot of chemical dependency issues also, and oftentimes those co-occur in this population.
Pretty quickly, within like the first 10 minutes, we were able to move right into what was bothering me, and over like the span of 3 months, I felt like I had gotten everything out of it that I needed to, and within a month I was feeling better. You don't want it to be some long, drawn out thing for a year or several months. It was like that.
I've been in the service. I served for 8 years. And so how I found that is helpful for me in my practice is that I speak the language. I'm able to communicate with them on a level. There's a lot of understanding that goes on and a lot of freedom from having to explain certain things that may not make sense to someone who hasn't been in the military. And so oftentimes that bridges a gap that can be pretty wide when a service member or a veteran is seeking out therapy for his or her issues.
I'm really, really pleased with my experience at LifeWorks Group and with Jeremy Lanning. It's been outstanding. There's a lot of people on staff that are trained to deal with this, who do have personal experiences with this. And I was able to feel really comfortable, really able to connect with somebody, as not just somebody who understands, but somebody who's actually been there. I'm just a lot more comfortable with how everything's going and just thinking things more positively now.
Infertility itself is tough enough to experience alone. A lot of patients do feel like they have nowhere to turn to, but fortunately, we're here in the community. We're lucky that at Dallas IVF, we have a one-stop shop type of center where the patient can come and receive a whole wider range of treatments and to help them get pregnant.
Some couples come to us because there's a male factor, sperm is poor. Some couples come to us because the woman has endometriosis or does not ovulate well. There's a whole range of reasons why couples come to us. About 15% of the patients we see in the office have what's called unexplained infertility. They have a completely normal workup, yet they're still unable to conceive.
Here at Dallas IVF, we offer a wider range of infertility treatments, ranging from basic aggressive therapy like taking medicines such as pills to grow an extra 1 or 2 eggs, combined with something called insemination or IUI. That's where we'll take the partner sperm and place it closer to the eggs within the uterus. Another treatment that we offer is a very aggressive treatment called IVF, also called in vitro fertilization. What that is where everything that occurs in the tube, which is particularly fertilization and embryo development and growth, all that occurs in a glass dish in the lab. So in that way, we can actually find the healthiest embryo and place those back into the uterus.
If there's a structural reason why they can't conceive, the tubes are blocked, there's fibroids, polyps in the uterus, endometriosis, for these people, we often have to take them to the operating room and try and correct those abnormalities. We're fortunate we operate at Forest Park Medical Center at Frisco, which provides the full range of services that we need on all our surgical patients.
Infertility and infertility treatments is like an emotional roller coaster. Hope and excitement followed by despair and frustration, followed by hope and excitement. But one day, there will be a little baby at the end of the road. It's so rewarding, especially when the families come back and they are so excited to show us their little child. It really is the best part of what I do.
That'll do it. That'll wrap up another edition of the Best Docs Network, featuring some of the best doctors in the Dallas-Fort Worth area that help change people's lives.
And if you'd like some more information on any of our fine doctors, just log on to our website, bestdocsnetwork.com.
And of course, if they have a question or comment for you, that is the public out there. We'd love to hear from you. Send us an email at info@bestdocsnetwork.com.
And stay tuned for our next episode of Best Docs Network featuring Forest Park Medical Center coming up next.
So long, everyone. We'll see you next week.